So, hello everyone. My name is Dr. Shaikh Baksh. I'm consultant cardiologist at Bahrain Specialist Hospital. And as a cardiologist, I get to see some of our pregnant sisters who come with hypertension during pregnancy. So, I'm here to talk about this condition, hypertension during pregnancy, which is associated with significant health risks to both mothers and the growing babies. So let us talk about it. Before I start, I want to ask you this. What does pregnancy mean to you? So the answer, some of you may say it's a blessing for you, or it brings happiness to the family. You may be privileged. Of course, as men, we can't get pregnant. So those who are chosen to be pregnant may feel privileged. And of course, the baby is always a gift from the God. But I would add that pregnancy also is a responsibility. It's a responsibility to take care of your as well as your baby's health. So pregnancy is definitely a beautiful journey, but during this journey, sometimes we may get hiccups, some bumps during this journey. And one of the health conditions that complicates pregnancy is hypertensive disorders of pregnancy or hypertension during pregnancy. It affects about 10 to 20% of pregnancies, and it is associated with significant maternal fetal complications. It adds to the cost, both financial or otherwise, in terms of psychological suffering. And there are long-term health issues, both to the mother and to the baby. Therefore, we should know about it to be able to take preventive measures. So what is the definition of hypertension during pregnancy? The definition of hypertension during pregnancy is elevation of blood pressure more than or equal to 140/90. As you would know, when you measure BP, there are two readings given by the blood pressure machines, or you might have seen doctors writing blood pressure as something over something. So the upper one is called systolic blood pressure and the lower one is called diastolic blood pressure. When the systolic blood pressure is more than 140 and or diastolic blood pressure is more than 90, during pregnancy, we call it hypertension during pregnancy. It complicates about 10 to 20% of all pregnancies, and it is the second leading cause of maternal and perinatal morbidity and mortality after postpartum hemorrhage. And different societies, there will be different common causes, but it is one of the top two causes of maternal mortality. Therefore, it is necessary to know about this condition, especially for those who are planning or somebody in the family who's planning for pregnancy. There are four scenarios during pregnancy hypertension can develop. One scenario is called chronic hypertension, in which the hypertension may be pre-existing, whether it is known to the person who's getting pregnant or planning a pregnancy, or whether it is not known, but it is pre-existing, or it is detected in early part of the pregnancy, especially less than 20 weeks of pregnancy. If it is detected, we call it chronic hypertension. Gestational hypertension is hypertension developing in the later part of the pregnancy, especially after 20 weeks of pregnancy. And a severe form of gestational hypertension is called preeclampsia, and the most serious form is called eclampsia. We'll talk about it a little while. And fourth scenario is preeclampsia superimposed on chronic hypertension. So these are the four situations or four types of hypertension we get to see in pregnant patients. About chronic hypertension, whether it is detected before pregnancy or not, or it is detected in the first part of the pregnancy before 20 weeks, we call it chronic hypertension. The thing to know about chronic hypertension is that some of the medicines that we give or we continue to take during our preconception phase. So some of these medicines are not suitable to continue during pregnancy. So it is important to know that your doctor is going to change these drugs, or if you are taking these medicines before pregnancy, before conception, and you should ask your doctor whether I should continue this or I should switch to safer medicines. That is what you need to know about this condition, especially a drug called AC inhibitor or ARV. These are the drugs which are not safe during pregnancy because they are associated with intrauterine malformations. To the child, they interfere with organ development, so it may interfere with their congenital anomalies are common if you continue. So you should stop them, switch over to some safer medicines. Of course, the doctor who is following up with you will be doing it, but it should be in your knowledge so that you can discuss with your doctor. Now, the second one is gestational hypertension, that is hypertension developing after 20 weeks of pregnancy. We call it gestational hypertension when there is no protein leakage in the urine, or there are no other signs of other organ damage like liver, kidney, other organs are okay. There is no damage or dysfunction. Then we call it gestational hypertension. We'll be talking about it more about this condition later. So, as I mentioned, the hypertension during pregnancy can affect both maternal and fetal health. Let us talk about a little bit about the how it affects the fetal health. Basically, it interferes with the blood flow to the placenta, or it interferes with the placental perfusion. Both is the cause, and that's a result of it. And this leads to slow growth of the fetus, low birth weight, preterm deliveries, and many occasions you will end up with situations where your doctor may want to do C-section rather than normal vaginal delivery. So these are the things that may be encountered if somebody has developed hypertension during pregnancy. In addition, there may be placental abruption, or what is called a separation of the placental layer from the uterus, which may interfere with the baby's health, and it may lead to premature delivery. As regards the effects on mother, these are the two conditions, or there is another I will talk about. These are the two conditions which we always fear, that is preeclampsia and eclampsia. These terms, you should be aware of these conditions and terms, so that if somebody develops high blood pressure during pregnancy, they can take precautionary measures. Let us talk a little bit about preeclampsia. Basically, it is a condition in which there is high blood pressure. In addition to, there will be protein leakage of urine with or without edema. Most often there will be swelling of the legs. So high blood pressure, protein leakage in the urine, and it has to be a significant protein leakage, of course, which is measured by either a spot urine measurement or by collection of urine over 24 hours. And a doctor may ask you to collect the urine over 24 hours and bring for the measurement of the protein. So if there is a significant proteinuria, there is definition, of course, and we need not go to it. Then we call it preeclampsia. In addition, there will be swelling of the limbs. There may be additional changes in the liver function, kidney function, and there may be additional symptoms like visual disturbance, nausea, vomiting, upper abdominal pain, headache, urine output may be decreased. These are the common symptoms you may encounter if somebody is developing preeclampsia, which is a serious situation if you encounter this or if you feel these symptoms, then you should alert your doctor, and you should go and check up with your doctor to diagnose and effectively treat this condition. Otherwise, it may lead to serious health issues both to mother and the baby. One serious or severe form of preeclampsia is called HELP syndrome. HELP stands for hemolysis or breakdown of the red blood cells, elevated liver enzymes, and low platelet count. In addition, there will be various other impacts on the organs, particularly kidney, blood, in terms of coagulopathies or abnormal coagulation in the blood, which may lead to placental abruption, or which may lead to postpartum hemorrhage during delivery. This condition usually occurs towards the later part of that is called third trimester, or in the immediately after the delivery, and this is a very serious and life-threatening condition which needs to be promptly diagnosed and treated. And some of the preceding symptoms or warning symptoms, which I just discussed, like headache, blurring of vision, swelling or excessive swelling, and abdominal pain, recurrent vomiting, these are the alarming symptoms which you may feel prior to this. So in these situations, if you alert your doctor and precautionary measures are taken, then you may not land up in this situation. And about eclampsia is the most serious form of hypertension or hypertensive disorders in pregnancy. When preeclampsia is associated with seizure or convulsion, we call it eclampsia. This is also a life-threatening condition associated with very high maternal and fetal deaths, which we don't see many, often these days, because of preventive measures are usually taken. Antenatal checkup is more common, and general awareness is higher, education level is higher, but still in some pockets of population, it can be seen if particularly people are uneducated. So this is also in addition to preeclampsia symptoms and symptoms of organ damage. There will be convulsion, and as I mentioned, there will be features of other organ dysfunction like liver enzyme elevation, significant damage to the kidneys, leading to kidney failure, and this is associated with heart failure, arrhythmias, and significant risk to the life of mother and the baby. These are the common risk factors you need to be aware of. If the mother is less than 20 years, or first delivery is first conception is more than 40 years. So first pregnancy is a risk, or we call it nulliparous woman. So a nulliparous woman or first pregnancy is a risk factor for development of hypertension during pregnancy, or especially so if you are less than 20 years of age or more than 40 years of age, then risk of hypertension during pregnancy is there, because we can say that your body is not in optimal physiological, mental, and physical shape. So nullipara or first pregnancy, especially less than 20 years of age and more than 40 years of age, is a risk factor. Apart from that, if you have multiple pregnancy, there are twins or triplets, and if there is an abnormal pregnancy in the form of molar pregnancy, there is genetic abnormality in the baby in the form of triploidy, which are common if the first conception is delayed. And if you have a previous history of preeclampsia, there is family history of preeclampsia, and if there is pre-existing hypertension or renal disease, then chance of preeclampsia and hypertensive disorders are more common in this. So being aware, if you are having some of these conditions, you should, suspect, and you should always have a close watch in discussing with your doctor. You should have a close monitoring, and you can prevent development of preeclampsia or its more serious forms. These are some of the alarming signs we should always keep in mind: headache, disturbed sleep, visual disturbances, whether it's a blurring of vision or floaters or any abnormality in the visual field, uh, excessive vomiting, upper abdominal pain, diminished urine output, rapid gain of weight gain, and abnormal swelling of the legs, and reduced fetal movements, which is a manifestation of reduced fluid in the fetal sac. These are the alarming signs. If you have some of these, you can alert your doctor so that they can take prior measures before they, go out of control. A little bit about the treatment, which is, of course, the responsibility of the doctor. If you are getting treatment and followed up at a qualified center, they will take good care, and optimal treatment will be given to you. But as a, as somebody who is, I would say, has a stake in this, you should also know about this a little bit. So delivery is said to be the sometimes said to be the only cure in cases of preeclampsia and eclampsia. So if you are suffering from preeclampsia or eclampsia, then your doctor may advise you to terminate or hasten the delivery depending upon the fetal maturity. So depending upon your stage of the pregnancy, your doctor may take a call to initiate the process of delivery, either by induction of your labor or a C-section. That is a call the doctor has to take. If the pressure is too high, then sometimes they take you to C-section. They will advise you for C-section. Some of the non-pharmacological measures the doctor may advise you to follow is limiting your activities. You may need to have adequate rest, including some bed rest. You should avoid alcohol, drugs, caffeine, and smoking. You should avoid stress, and you should avoid anxiety and nervousness. You should be adequately hydrated, and your doctor may advise you to take diets rich in potassium, calcium, and magnesium, and omega-3 fatty acids, and all this in addition to the pharmacological measures that doctor will advise. First and foremost, of course, is the hypertensive medications, which are safe. I'll be discussing in a while. In addition to that, your doctor may advise you to take aspirin, low dose aspirin, starting from the 12 weeks of gestation, which helps in the blood circulation of the placenta. And placenta, as you know, is the source of everything nutrition to the baby, growing baby. So to improve the placental circulation, aspirin is in a low dose is given. In addition, there may be you may be given calcium supplementation, and drugs like hydralazine, labetalol, and methyl-dopa are the antihypertensive medications that are used during the hypertensive disorders in pregnancy. What you need to do, or what is your role in this? First is being aware of the symptoms. Being aware of the condition is half the job done, because if you are aware of the situation, something like this can happen, then you can take precautionary measures, and you can of course, in consultation with your doctor, you can take various measures. From your part, what you can do is you can measure the blood pressure closely at home more frequently. If you are in this vulnerable group of people who are likelihood of developing hypertension during pregnancy, you can measure the urine volume, and you can check the protein levels. Of course, that will be tested by the healthcare facility. You can check if you are developing any signs like edema, abnormal weight gain by measuring regular weight. And when you go to a doctor, they will, of course, check your fundus, eyes, and they will do various blood tests for early detection. In addition, you can also keep a watch on the fetal movement. Anytime there is limitation or there is reduction in the fetal movement, that is also an alarming sign. You can alert your doctor about this. Most important part is in this is proper regular antenatal checkup, because that is how early stage of hypertension in pregnancy can be detected, so that you don't develop the later manifestations like preeclampsia, eclampsia, or HELP syndrome that we discussed. So regular proper antenatal checkup, and I should add at a qualified centers like BSH, should be done regularly, and that is the most important factor, because most of the decisions can be taken by the doctor. Most of the things we discussed will be taken care of by the doctor itself. Only thing is that you need to know about this so that you are in the same page as your doctor regarding decision making. But most important in this is regular checkup. So these drugs already I discussed, these are safe in pregnancy. You should not be hesitant in taking any drug your doctor advises. Sometimes we have seen mothers who are pregnant, they fear that the drugs may harm the baby, so they do not take. They think that hypertension only affects them and not the baby. So drug that is given or medicine that is given is for them, not for the baby's health. So what they do is they can take risk in terms of their health, and in order to protect the baby, they stop taking medicines, which is wrong. So you should not fear any medicine that is given by a qualified doctor, because he has taken all the pros and cons into account, and he advises the drug keeping in mind best for you and for your baby. So these are the drugs like methyl dopal, labetalol, hydralazine, nifedipine, and nitroprusside. These are the drugs in different situations, of course, given. Some are oral, some are intravenous, depending upon the necessity or speed of the need of the drug. We advise medicines accordingly. Oral medicines are advised when for regular therapy, and intravenous medicines are advised when there is need for rapid control of the blood pressure and all that. So these are the drugs which are safe, and you should not be hesitant in taking these drugs. So in conclusion, hypertension in pregnancy is associated with significant maternal and fetal risks. In fact, this is one of the top 2 causes of maternal death all over the world. Early detection by regular antenatal checkup is the key to successful pregnancy and delivery. Symptoms may be subtle when they are early. So keeping in mind your stage of the pregnancy, keeping in mind your risk factors, keeping in mind your previous experiences, and keeping in mind the alarming symptoms will help you. If you develop some of these symptoms, you can alert your doctor so that immediate action can be taken. Always follow the doctor's advice. If your doctor is qualified and you trust your doctor, and you are following with him or her, and he advises something, both in terms of pharmacological and non-pharmacological measures, you should always follow them and be aware of the alarming symptoms, because they are always they always precede any serious consequences. So whenever there is any alarming symptoms like headache or blurring of vision or reduction of fetal movement or shortness of breath or significant weight gain or proteinuria or edema, so you should always alert your doctor, and your frequency of visit should be more. Some cases you may be hospitalized even much before your delivery time. So you should not be hesitant in taking taking the call as advised by the doctor. So wish you all the best. Have a good, successful delivery and pregnancy. As I said, pregnancy is beautiful journey, and we should be able to take care of our health and our baby's health in this. Thank you.